can show you this side too. Maybe it's better for you guys. So AC separation. Like you need to find the right spot if you feel like you need to tear the adhesion, right? So usually when you follow along the clavicle and then find where is the acromion, and then where it meets, it's gonna be the AC joint. So don't fall for it too close here. Sometimes there's a loop that you can feel, then it feels like joint, right? But not, it's gonna be close to the acromion. You need to always feel where is the acromion, and then you can find the joint line. So friction, if you're gonna do it, then it's gonna be this way, right? Along the joint line, because it's cross fiber friction. Or you can just perform the J-stroke or a little bit of the skin rolling around that area because they have adhesives, right? And then after you perform friction or anything, then you can try to do the joint mobilization too. When the AC joint, like AC separation happen, usually it's kind of compact injury fall onto their shoulder, right? So then not only AC joint is affected, their SC joint is affected too, possibly. So then this traction is possible. Have you guys seen this one before? So with the sheets over top, usually it's easier for you to have the sheets, then it's easier for you to grab their clavicle, and then you can kind of try to move it away from it. Or like if the gripping is too hard, some people, if they have the tight pec muscle and large, then you cannot really grip it. So then where you can use is here, like between your hyper and hypothenar area. You're gonna place the medial end of the clavicle like this way, and then you're gonna bring it like toward like this way. So, feel okay? Then you're gonna hook the end and then distract. And when it comes to the AC, so then you can move like anteriorly or posteriorly too, or like just the distraction is possible to just of the injury, then you may need to play safe, right? So then you shouldn't do too much about it anyway, right? So you can kind of have it separate, like this side has to be stabilized with the fingers, and then this side has to be moved away. So usually my hand here is going to be easier for you to do this one while I'm stabilizing this one. And especially once you perform the friction on the joint, so then you need to do a little bit of the pull, like stretch, right? So then joint move is the way. So but easiest one that you can do is actually just wiggling their end of the clavicle a little bit back and forth, like anterior and posterior glide. So you're gonna stabilize on here and then try to grab their clavicle, because you don't need to move like big motion, right? So then you can kind of try to wiggle it a little bit to give the little bit of the stretch to the tissue, right?